suicide, one of the most painful, misunderstood, and urgent crises of our time. It is not simply a personal tragedy, it is a public health emergency, and it is rising. Around the world, suicide rates have increased in the past 2 decades. In some groups, especially young people and middle-aged adults, the numbers are climbing sharply. The question we must face is this: why are suicide rates rising? And what does it say about our mental health systems, our societies, and ourselves? This is not a topic we can treat lightly. It deserves depth. It deserves honesty. It deserves compassion. So let's take a deep dive into the psychiatric and societal forces driving this crisis and into the ways we can respond. The scope of the crisis. Every year, nearly 800,000 people die by suicide worldwide. That means one life lost every 40 seconds. In the United States alone, suicide rates have increased by more than 30% since 2000. It is now one of the leading causes of death among young people aged 15 to 29, and it is the second leading cause of death among adolescents. The numbers are staggering, but behind every number is a person, a family, a community, and the ripple effects of each suicide spread wide, leaving grief, confusion, guilt, and pain in their wake. Psychiatric factors. Driving suicide at its heart, suicide is deeply linked to mental illness, but it is not explained by mental illness alone. The psychiatric contributors include depression, the strongest predictor of suicide, with hopelessness being the key driver; bipolar disorder, especially dangerous during mixed states when agitation and despair collide; schizophrenia, with voices commanding self-harm or paranoia, isolating people from help; substance use disorders, drugs and alcohol lower inhibition, intensify despair, and increase risk; anxiety disorders, panic, constant dread, and insomnia erode resilience; PTSD, flashbacks and trauma memories can overwhelm the will to live. One common thread across these conditions is unbearable psychological pain, what psychiatrists call psychache. When the pain of living feels greater than the resources to cope, suicide can seem like an escape. Biological and neurologic vulnerability. But mental illness alone does not explain why suicide is rising. There are biological factors at play. Research shows that dysregulation in the brain's serotonin system increases impulsivity and despair. Structural differences in the prefrontal cortex affect decision-making and emotion regulation. Genetics play a role. Suicide risk runs in families. Sleep disturbance is a powerful predictor. Lack of restorative rest destabilizes mood. These vulnerabilities create a biological landscape where stressors hit harder, hopelessness feels deeper, and impulsive action becomes more likely. The role of trauma and adverse childhood experiences. Behind many suicides lies trauma. Adverse childhood experiences, abuse, neglect, domestic violence, parental substance use, poverty, increase the risk dramatically. Why? Because trauma shapes the brain. It disrupts attachment, erodes trust, and wires the nervous system for hypervigilance and despair. Adults who experience multiple forms of trauma as children are several times more likely to attempt suicide, and unresolved trauma often resurfaces during stress, loss, or failure later in life. Societal pressures and modern stressors. Here is where psychiatry intersects with society. Even as treatments for depression and anxiety have improved, suicide rates rise. That tells us there are forces beyond biology at work. Some of the most powerful include economic stress, job loss, debt, housing instability, financial insecurity, social isolation, declining community ties, loneliness, weaker family bonds, digital culture, cyberbullying, online harassment, toxic comparison on social media, academic and work pressure, relentless demands on young people, burnout in professionals, access to means, firearms, pesticides, opioids, bridges. The tools of suicide make attempts more lethal. Global crises, wars, displacement, climate anxiety, pandemics. In many ways, modern life adds relentless pressure while stripping away traditional sources of support. The paradox of progress. 1. Painful paradox. Even as awareness campaigns spread and more people talk about mental health, suicide rates rise. Why? Because awareness without access to care does little. Because stigma remains, especially in marginalized groups. Because even when treatment exists, it is often fragmented, unaffordable, or hard to reach. Because medications and therapy cannot fix social inequality, racism, or systemic injustice. Progress in psychiatry cannot overcome a society that isolates, exploits, and neglects its vulnerable. Suicide in different groups. To truly understand the crisis, we must look at specific populations, adolescents pressured by academic competition, online comparison, bullying, and identity struggles, LGBTQ+ youth facing stigma, rejection, and discrimination with much higher rates of attempts, veterans carrying PTSD, moral injury, chronic pain, and easy access to firearms, indigenous communities, generations of trauma, poverty, and marginalization fuel devastatingly high rates, middle-aged adults, economic despair, loss of purpose, substance use, chronic illness, older adults, isolation, grief, illness, loss of dignity. In each group, the drivers are unique, but the outcome is tragically similar. Warning signs and crisis points. One of the challenges in prevention is that suicide can appear sudden, but often the signs are there. Talking about death, hopelessness, or being a burden, withdrawing from friends and activities, giving away possessions, sudden calmness after a period of agitation, increased substance use, reckless behavior. The crisis point comes when a person's protective factors collapse, support, purpose, coping skills, and the pain feels unbearable. At that moment, suicide can feel like the only option, and sometimes it happens impulsively in minutes or hours of unbearable intensity. The stigma that silences. One of the cruelest barriers to addressing suicide is stigma. People fear being judged, locked away, or shamed if they admit suicidal thoughts. Families hide attempts out of embarrassment. Communities avoid discussing it, fearing it will spread ideas. This silence leaves people alone with their pain, and isolation is the enemy of survival. The truth is, talking about suicide does not cause it. Talking about suicide saves lives. The role of media coverage has a profound influence on suicide rates. Sensationalized stories, graphic details, or glorified portrayals can trigger what's known as the Werther effect, a rise in copycat suicides. But responsible reporting can have the opposite effect, the Papageno effect, showing stories of resilience and recovery that protect against suicide. In the digital age, where news spreads instantly and widely, media responsibility is more critical than ever. Paths to prevention. So what can be done? Prevention must be both psychiatric and societal. Access to care. Affordable, accessible mental health treatment. Crisis hotlines and text lines. Immediate support in moments of danger. Means restriction. Limiting access to firearms, toxic pesticides, high bridges, community programs, peer support, group therapy, safe spaces, school interventions, teaching coping skills, resilience and emotional literacy early, workplace wellness, reducing burnout, providing support, normalizing help seeking, policy reform, investing in mental health infrastructure, reducing inequality, funding prevention programs. At its core, prevention means surrounding vulnerable people with protection, hope, and alternatives. Stories of survival. Amid despair, there are voices of survival, people who came to the edge and chose to stay. They describe how a single conversation, a supportive friend, or a timely intervention saved them. Their stories remind us suicide is not inevitable, it is preventable, and people in pain do not want to die, they want to stop hurting. If we can relieve the pain, we can save lives. Closing, plain, compassionate tone. Suicide rates are rising, and the reasons are not simple. They are psychiatric, rooted in mental illness, biology, and trauma. They are societal, driven by inequality, isolation, and modern pressures. They are systemic, shaped by access to care, stigma, and policy. This crisis is not a mark of individual weakness. It is a reflection of how our societies are failing to protect mental health. But the cycle can be changed. With treatment, with compassion, with systemic reform, with honest conversation, suicide is preventable. Every life lost to suicide is one too many. Every voice silenced is a story unfinished. And every person struggling deserves to know you are not alone. You are not broken. You are not beyond saving. There is help, there is hope, there is tomorrow.